evening and welcome to another informative episode of Health Check on Hope TV, where you look and live. My name is Kerry Kagiri. Now, do you remember about chromosomes? Well, today it's all about that, and I know most of you only remember mitochondria, and you're wondering, Kerry, what do chromosomes have anything to do with life? Well, we're going to be dissecting that with great people in studio, and some of them are about to get vaccinated for COVID. I found that very interesting, but we won't get into that. Let's focus on our topic today, being Down syndrome. This video is up on your Facebook, it's up on YouTube. So what you could do is take a moment to just share it with your friends and let everybody learn as I'm learning as well. On my right, bright and beautiful, doctors who are cute, they're kind of nice. Her name is Dr. Susan Wamithi. She's a developmental pediatrician.
Yes.
So that's a little bit about what you do in developmental pediatricianism.
So a developmental pediatrician is a doctor who takes care of children who have special needs and anything that's interfering with your developmental milestones, if you have a disability, so that's what we do.
Absolutely.
Yes.
And in today's topic, is this one of the most common things you deal with, or it's just part of a big, what are some of the areas?
So it is one of the things that I deal with, autism, cerebral palsy, Down syndrome, of course, language disorders.
Okay.
Yeah.
Oh, awesome. So speech therapy?
So I'm not a speech therapist, but I know where.
So you refer?
Yeah, so I refer.
Okay, got it. Awesome. Just want to understand a little bit about what you do. And with me here is our second timer, our guest. You all know Duncan Kyengo, an occupational therapist. Thank you for coming again.
Welcome.
And for someone who's watching, you just tell them for the first time, tell them what you do and how you participate in this particular Down syndrome.
As you have said, I am an occupational therapist. Ideally, occupational therapists help people, and on this particular topic, they help children who have Down syndrome to acquire skills that will enable them to perform their daily thing, their daily stuff. For example, like toileting, like walking, like feeding themselves, like dressing, like buttoning, like zipping, and etc.
Okay.
So ideally, it's about enabling people to live independently, and not just independent, but quality life is very important.
Absolutely.
Yeah.
I think that's your statement all the time when you come here. You're like, people need to live quality life and be independent.
Exactly.
Absolutely, be able to do everything on their own. And on the extreme left, this lady is so cool. Check out her shoes. She was out here just doing walks and being fit in her life, but she's also working for a cause, and she'll be telling us about that just now in your introduction. Lilly Mugane, karibu sana. You're a caregiver.
Yes, I am.
Awesome. And tell us a little bit about why you're like all sporty action, and also tell us what your t-shirt says.
As you've said, I'm a caregiver. Our son is 6 years old. He was born with Down syndrome. And I'm all sporty because I needed to catch up on my kilometers. I'm participating in this challenge to have done 213 kilometers. By 21st of March.
Okay, so 21 and 3.
Yes.
Okay, great.
Yes. So I'm lagging behind.
Thanks for your honesty.
Yeah, so when I came in, I saw I had like an hour. I was like, can I just catch some? I've done 3 kilometers.
Excellent. You're a hero. Modern day superhero. Good job. It's progress. It's all about that. So how can guys check this out and be a part of the challenge? How can guys participate in what you're talking about?
You can just reach us. We have a Facebook page, T21 Families Support Organization. We now track each other via Samsung Health, and we also Strava. So depending on what app you're using, we then keep each other on check. And we hope that this will become a lifestyle beyond 21st of March. Then I'll be more fit, and we can do this more as moms, as parents. Yes.
And create awareness and just woosah.
Yes,
think about your life.
And you asked why I wore these,
yes,
also, the t-shirt. It says love doesn't count chromosomes. Because, I love that.
I saw someone who said, I have one extra chromosome, so what?
Yeah.
And let's talk about it now, since we're here. Daktari, what is Down syndrome?
So Down syndrome is a genetic disorder,
And what it means that individuals who have Down syndrome have an extra chromosome, and that's chromosome 21, as Lily's T-shirt says. And so what it does is that it causes a variety of either medical conditions and even, as Duncan has said, difficulties with their developmental milestones, whether it's their fine motor skills, their gross motor skills. But what's important is how we enable them reach their developmental potential and assist them along the way.
I absolutely love it. Other than that one, you could just maybe educate us. Are there different types of chromosomal disorders as well, just as we get now, before we get deep into Down syndrome?
There are very many. And so I think you had mentioned if you have one less chromosome, like 45, and so that's Turner syndrome. There are those who have like extra chromosomes. You can have Klinefelters where you have XXY. So they are different. They can involve either the sex chromosomes or what we call the somatic, like chromosomes, meaning those that are not sex chromosomes. And so you can have extras, you have deletions, you have duplications, but what matters is their functioning. So whatever the diagnosis is, our job is to help the child in terms of their functioning, both socially, academically, occupationally. Those are the goals for therapy.
Absolutely. What are some of these signs that a child has Down syndrome? And I want to maybe start with you, Lily, and then come to Duncan, because he's met people, probably the parents don't even know at some point. They're just like, we've been sent to you. What are we supposed to do? So maybe you can tell us, what are some of the signs that a child has Down syndrome?
There are many, there are quite a number that we call them markers. Actually, the Kerry would have been best to say, to give them well, but it's just physical. Mostly it's physical. So there's the eyes, they're called the emerald eyes. Then there is the hand, there's a crease on the hand.
It's only one crease as opposed to...
we have. So there's that. Then there's the toe. There's a term for the toe, the big toe, and the other toe. There's a big gap. So most of the time, if you see that with your child, it's a marker. It tells you should find out if the child has Down syndrome. So the best way is to now ask the doctor, I'm suspecting, and then the doctor will tell you for sure if your child needs to have further assessment. But the actual test that can confirm is karyotyping test. It confirms whether the chromosome, the extra chromosome is there, and then the type of Down syndrome the child has.
Absolutely. I'll be coming to you, Dr. because I want us to go deeper in that. But she's a mom. When did you discover your child had Down syndrome?
No, our child, Munene didn't actually show the markers at birth. Our paediatrician told us, because he was born via CS, it was neither here nor there. So the doctors who are there, even them, they're like, oh, we are not sure. But anyway, by month 3, we will see, we will tell. So by month 3, when we are going for a normal clinic, remember, they didn't even tell us at birth. So they were just talking amongst themselves, but they didn't tell us. I'm glad they didn't, because I got time to just bond with the child.
As a child.
And not, But people have different ideas. Some say I would rather know immediately, but for us, we say it's good. It was good, we knew later. So at month 3, when you're going for a typical checkup, we ask the doctor, is this normal? Is it typical? Because Munene was his muscle tone was, I would say he was floppy. So when you hold him, you're feeling like you're holding a pillow. So we kept being told, he's a boy. I'm a mother of 3.
Wow.
So I have 2 older girls.
Okay, before Munene. Okay.
So I'm told, no, boys grow differently. Just he will be fine. Or maybe it's your milk. It's, you're small. You're watching your weight. You're not eating such things. So by month 3, we were like, no, this is not it. So when we're asking the doctor, she was like, are you suspecting anything? I said, are we supposed to be suspecting something? Then she was like, okay, because we suspected at birth, but in the meantime, what you can do, let's do blood work and check. What are we checking? Said, we suspected Down syndrome, but it was neither here nor there. The only way to confirm, let's do a karyotyping test. So, we did the test. She gave us material to read. When we read, we were like, okay, so If it's there, we move on. If it's not there, we move on. So moving on. But that time we hadn't seen the stigma, the negative material. The material she gave us was it's just a delay in milestone, acquiring your milestone. So that's it. So yeah, the karyotyping test was done. It was South Africa, 2 weeks for the blood work to come back. So after 2 weeks, that's when it came back. We were called to the office and it's positive. And she was, I think, shocked because she didn't, everyone loses the child that they expect. The child I had before the 3 months, the diagnosis, I lost the vision I had, So even the doctor herself, when she saw it positive, she actually was down. She cried. Now that's when it hit us. What is it? Is it that bad? We didn't see anything wrong. But I guess she cried because she lost the child she thought she was going to take care of. She's our paediatrician, even with the others.
Okay.
So we now from there moved on. She told us, you need to first go see Kyengo.
Awesome. And I'm really looking forward to getting to Kyengo and what he can do. But we need to just go back a little bit and ask Daktari, can we tell the signs of Down syndrome when pregnant? And this is in the assumption that Down syndrome only happens, through my little research, only happens during when the egg and the...
Those ones.
Yeah, when they are meeting, not in person, elsewhere. I'm so sorry. I'm like, is it still watershed? Yeah. So when they're the fertilization process.
Yes.
Yes.
And yes, using your terms, yes.
Okay.
And so prenatal diagnosis is possible.
Okay.
And so we have specialists who are obstetricians who deal with fetal medicine. They're able to do like blood tests that can show the same. They're able to do fetal ultrasounds, and when it's suspected, then they do further analysis, just looking at whether there is any cardiac issues with the baby still when the baby is in the uterus, and then they check for any bowel malformation. So they are processes and blood tests and ultrasounds can show that.
What cues someone to ask for those?
And so there are those that are, it depends on the hospital that you're based.
Okay.
Some hospitals it's routine, you
Okay.
have to do it in the first trimester. And so that's like part of the routine tests that are done. And the parent has a choice. Of course, we don't force anything done on anyone. There are those who want the test done, there are those who decline, and that is fine with us. Yeah.
Wow. Okay. The conversation today is on Down syndrome, and Lilly, you've been so open to just share with us your story. We'll continue to talk about it. It is Down Syndrome Awareness Day, month. Okay, month. The day will be celebrated on the 21st of this month.
Yes.
Yes, and so you can join the conversation. You can ask the questions. We have great people in studio. And so let's talk about how you then refer people to Kyengo so that we can get to what Kyengo gets to do with the children.
So for once, as Lilly gave her story, is that for those who were able to do prenatally, we prepare that family in terms of getting the neonatologist on board, and then making sure that there are no health medical issues like cardiac malformations. That's the usual medical assessments. And then early intervention is where Kyengo comes in, because we want to take advantage of the fact that the brain is still growing. There's still something called neuroplasticity, and his job is to optimize that aspect of things.
Absolutely.
So that is there. Once we know the child is stable, it is to the occupational therapist, and that's what Duncan does.
Absolutely. When I come back to you, Daktari, we'll be talking about the diagnosis and the test she's talked about. She used a very, you said
Karyotyping.
Yeah, we'll talk about that shortly. But so you are now introduced to Lilly, and she came in with her, I've heard you saying we, so it means you have a supportive partner?
Yes.
That's amazing and a blessing.
Very
Yes.
amazing.
And so we came to you, and so you met Munene. And what's the next step of action?
Yes. Just before Munene came in, I got a call from the primary pediatrician.
Yes.
I love her. She's a very mathly pediatrician. And then she called me, she told me, I have quite sad news. So tell me, I have sent some young couple, please handle them carefully and discuss the condition with them so that they understand. You know, after dealing with some of these conditions, I've come to realize one thing. Even us, as clinicians, sometimes things can take toll on you. You know, we are not immune to
the emotion.
I think I need to confess this. I took my wife yesterday, last night, for delivery.
Oh, congratulations! Hey! Daddy, you're supposed to be at paternity. Get out. Go.
We got a baby girl.
Congratulations.
We got a baby girl today at 12:30.
Is that why you're in pink?
Yeah.
Oh, yeah.
Congratulations.
Now, you know, expectations. There's no one who expects to get a baby with special needs. So we are all full of expectations. And sometimes it's fine as a clinician or sometimes as a mother to feel, oh my God, things have just gone wrong. So it's fine. But the most important thing is, where do you go from where you are seated? Dust yourself. Dust yourself. Because it's just a journey. And you got to have to embrace yourself. I have this to say. Dr. Wamithi came to save us. Apparently. I know you don't want to hear this, but I have to say
Okay, please say it. Okay.
for the longest period of time. How many developmentalists do we have in this country?
So now we are 3.
Wow.
Actually, in East Africa, we are 3.
Thank you.
In East Africa.
So before just Dr. Wamithi came just the other day, we were in a very bad shape as a country. So this, I'm saying this because I'm trying to bring up the team. The just before you begin intervention, the parents are very quick because you got to have to handle the parents.
Yes.
Because if you don't handle the parents, because the parents take care of the baby. When the parents are not fine, the baby is not fine. So, and some of these things, when you have to deal them with, when you are limited in terms of the clinicians or the professional, we should do this together. I'm not saying that we don't have pediatricians, we do. But specialization is very key in some of these things, you know. So it's fine for, anyway.
Tell us about the gap she came to fill. I'm really curious about that because we had the conversation here with the board as well, and they were telling us we have 3 this, we have 1 emergency specialist, I think, who you work with. He's in charge of emergency services, only 1 trained emergency specialist who has updated his, we have to do 1 what, we have 2, we have 3, now we have 3 developmental pediatricians. It's quite interesting. What gap did she fill?
I think what she did is she brought a sense of teamwork in dealing with children with special needs.
Yes.
Not just the children with Down syndrome. You know, children with special needs, their needs are very broad. They are very wide. And when you are trying to discuss this with people who really don't understand this thing, you just want to treat a baby with special needs like a regular baby. Of course, we've all been to medical classes. That's fine. But specialization is very key. It's very important.
Absolutely.
So that's what she came to fill the void. And we are happy to have her.
Okay. So we came with our son Monene.
Yes.
So what did you do to Monene first?
So I of course, had a chat with the parents first, and then a little bit of some sort of painting what Down syndrome is, what to expect. And then I remember one of the things I had very difficult time explaining is what low muscle tone is. Because Lily's husband, Ken, it was not making sense.
Hi, Ken.
Yeah. So when I say we have an hypotonia here, and then what hypotonia is all about, and how it impacts the development milestone, and how we should be careful that feeding when we feed, we don't make mistakes, and then we risk the baby getting pneumonia and such stuff. So it's a very important information. So that's what we sort of went through. And then from there, of course, we drew the treatment plan together. We fixed our goals. Of
So
course
you create new milestones
yes.
for the baby.
Yes.
Yeah.
We sort of, because the milestone for children who have Down syndrome, they're not the gazetted milestone that for regular babies. So they have their own sort of a calendar and expectation of what we need to meet. So that is exactly what I did with Lilly, Ken, and Munene. And then from there, at some point, we discussed family, how to disclose some of these things. The people who you consider important for you, so that because sometimes it comes a time when you require a lot of moral support, especially from family. And then from there now is what to expect in the future of these children.
We'll get back to that because we'd like to go into a detail because there's someone who's watching and probably they've never been able to get to you or to any occupational therapy. So they've had their child locked in the house and other things that we'll also be talking about. I think Lily is very passionate about this and encouraging moms. And so we'll come to that. Daktari, let's talk about that diagnosis. Are there people who have come to you with a child who's even slightly older who just, they didn't know?
Yes, they have. And luckily they've come in infancy because as people are raising awareness, and I keep saying the family support groups are important because they're out there, they have these campaigns and they're like, oh, I think what Lily's talking about in TV is resonating with me. And so they come 6 months, 8 months. And so they do come who've not been diagnosed at birth.
Absolutely. And the diagnosis you talked about, the word that I still can't say.
Yes, the karyotyping.
What is karyotyping?
So karyotyping is where they take, so all of us have chromosomes in our body. And what those specialists do is look at those chromosomes and they count them out. And so each of them, like especially for Down syndrome, is that when they come to the chromosome 21, they notice that you have an extra chromosome. So you're supposed to have 2, so you have 3. And so, and those are in every cell of your body. You have that third chromosome. Every cell has that extra chromosome.
So how is that done? Like, is it like something? Is it blood?
It's blood, and then they look at it. They look at the chromosomes and they count
with that thing. Like
for lack of a better term.
I want everyone who is watching to understand.
So for that cell, they count and see how many chromosomes do you have. And the way God has created us is that they're able to line them up and be like, oh, you're number 1, just because of studies done before. These are the pair for number 2 here, the pair for number 3, the pair for number 4.
I saw some that even look like a K.
Yeah.
Some look like a short one and a long one.
So and then we have the geneticists who are able to pair them up correctly. And then when they do that, they say, oh, here are the three chromosome 21.
Okay.
Yeah, so
absolutely.
Yes.
Okay, quite interesting. Let's talk about telling people, because we have so many things and we'll get into treatment and management, we'll get into if it's preventable. So many questions are coming your way, Daktari and Kyengo, but let's talk to you. What was the next step after seeing Kyengo and now starting life? It's 6 years now. Look at you go.
Yay.
Congratulations.
And counting.
Absolutely. And counting, of course. Many.
Yeah. So after now we've been referred to Kyengo. Yes, we've gone through, can we start this? We started off with the occupational therapy. But we remember the first month, we mourned, totally. We were sad. We were thinking, now what's this? Because we went to Dr. Google and we saw all.
Oh, yeah, Doctor, Dr. G.
So, yes, we mourned. And I remember looking at Munene at that point, and he changed. He looked different from the Munene I knew. And I told Ken, it is not Munene who has changed. It's me.
Yeah.
It's all in my mind.
Absolutely.
Yeah. Just like, really, how can I beat myself up? How can I just make my child change? Now I started seeing the pictures I've been seeing on Google, all those things.
And the characteristics, yeah.
And earlier I wasn't seeing before the diagnosis. So that's when it hit me. It's in my mind. And we're like, this has to end. This has to stop. The mourning also had to stop.
Yeah.
As Kyengo has said, pick yourself up and move on.
Morning endures for night, but joy comes in the morning. Can I preach to somebody?
So we're like, if we've been told, we keep saying God will wipe our tears. If this boy is making us cry, then by wiping our tears, will he be taken away from us? That's not what we want.
No.
So we move on.
Yeah.
So we said, so how do we move on nicely? First, can we tell our parents? Can we tell our support system?
Can we start with the sisters?
Yes.
Did you guys start with the nuclear family, and then to the family? How did you do it? Just tell it to someone. Probably someone is struggling right now as they are watching.
Yeah. Now what we did. Now we decided to kill all birds with one stone.
Okay.
So I remember it was over Easter.
Yeah.
It was now April, and we said, people, we have a luncheon. So guys, come, let's have a nice lunch together. So we planned out a nice lunch. We went, we are eating, and when people are mingling and happy, so it was both my side and Ken's side, so parents and siblings. And when they are all done with eating, they're like, so you've been asking, you've been saying, oh, how come Munene, the neck is still wobbly? How come you've been asking these questions? So here is the answer. Pap. So we have the diagnosis. Munene has Down syndrome. It's nothing to do with the milk. It's not how he's not being taken out to the sun enough.
It's not me who is trying to keep my weight going. And by the way, we'll talk about myths, Daktari. We'll talk about myths and ideas that people have of what's happening. So you dropped the bomb.
Yeah, we dropped the bomb. And we told them, so this is the diagnosis. And obviously, as expected, it's, no, this does not happen to us. It's not true. We, God can take away illness, all those things which are expected by every other person. So we were like, okay, now this is it. We just needed to let you know. And we are moving on from here. The most important thing is Munene will be treated like every other child. So you have your 1 month to also mourn, because we had our month to mourn and be in denial and
do your research,
do everything.
Yeah.
But after 1 month, we are moving on as a block, supporting this boy, not treating him any specially, just taking care of him like any other child. And if we see segregation or special treatment or anything that as now Ken and Lilly feel is not right, we will call it out, and you can be excommunicated.
Are you guys Kenyans? That's not a Kenyan thing to do, but that's a right thing to do. And the story has to come from you. I feel like sometimes we have to dictate the narrative and what we expect, and you lay it out there. So if anyone is crossing boundaries, because you have to protect yourself, you have to protect your child, you have to protect your family, you have to protect your own heart. And so, wow, that's one thing that's really powerful that they did. Hey, guys had come, mbuzi ilikufa. Guys are told. I really like that. That's really powerful. And it's really because you guys are a block already, you and Ken. And that's a big deal. We're getting to early interventions, and if you're just watching us, we are speaking about Down syndrome on Health Check on Hope TV, where you look and live. If you just joined us, Nico Harper, I'm with developmental pediatrician Dr. Susan Wamithi. You can say good evening, viewers. And of course, Lilly Mugane, who's a caregiver to her amazing son, Munene, and Duncan Kyengo. If you are a viewer, you know him. He's our seasonal occupational therapist. Yes, our station, actually, not seasonal, station. You're hired. You have a job here. And we're talking about these early interventions. I think this is where we come to you again. What are some of the things that you've had to do now practically in terms of this? And is this the treatment for Down syndrome?
So it's part of the treatment.
Part of the treatment. So we'll talk about the other part with you just shortly.
So early intervention is very important because what happens is we say in neurology that one of the adaptations of the human brain is neuroplasticity. So we say that a brain which is young has more potential to be taught. Lilly just mentioned some of the few things which are purely physical. But when it comes to early intervention, one of the very important things that we need to handle early enough is what we call muscle tone. I know Dr. Wamithi may want to add some information on this.
Absolutely.
The
You're
children
welcome.
are born with some systemic issues like the thyroids. And these thyroids, at some point, they are issues that has, they give or they resort to some condition of the muscle whereby the baby looks lazy. I think that's the best way to try and put it in a layman's way. They are, that activity of a baby of kicking, lifting hands and such stuff is not there. So there are other types of tones, but we say this particular one is hypotonia. So everything in the human body relies on muscles. You breathe using muscles. You suckle, of children suckle using muscles.
Wow.
We all swallow using muscles. Children go poo-poo using muscles. Even adults, we even whatever, everything that we do has muscles. So when you have hypotonia, it's a generalized thing. In other words, you have challenging is performing some few things. So one of the things that you are likely to note early is the ability of a baby to latch. So when you realize this, then feeding becomes a challenge. At some level, when the hypotonia is very severe, such that you have a problem with latching, then we have to send the baby back again to, or we have a discussion with the pediatrician, and we say we are developing a problem here. Because the more they struggle to suckle, sometimes the swallowing process includes constriction of the gut muscles to force the contents in the mouth down.
Is that the esophagus?
Yeah, you're
Okay.
not wrong. So what happens is uko. So what happens is this: sometimes this content misses way and finds itself in the lungs.
Oh no.
So when this happens, then the next thing you realizing is the baby is back into a hospital, and many times not just in a hospital but in ICU.
Is this why you mentioned pneumonia?
Yes.
Oh, wow.
So they become frequent victims of chest issues.
I'm curious, Lily, did you go through that? How was it 3 months before you went back to Daktari? Was Monen able to latch?
Imagine we were good.
Wow.
Pretty
We
good.
were good, yeah. His muscle tone, at least swallowing, latching, he was good.
Wow. Okay.
Yeah.
So what happens is that's one of the most things that I like going to deal with it as a matter of early intervention. I deal with the tone, and I deal with the tone, especially oral muscular strengthening, to allow the baby to suckle and suckle properly and get the food straight to the stomach, but not the food to miss way and then find itself elsewhere.
Okay.
And then the other thing is now the general physical muscles, because my next target is achieving a milestone. The next milestone I'm looking for is head control here. By in 3 to 4 months time, I need to have stable head control. So that's what becomes my target. And then I follow up with the rest of the muscles slowly by slowly. And then muscles are training milestone is very wide, because we have physical milestone, which is about head control, sitting, crawling, standing, walking. And then from there, other than that, we have what we call cognitive milestones.
Yes. Like that one when you do this to a child and they're supposed to
Uh-huh.
hear the sound.
Yeah, you know, like smile
Yeah.
and so on and so forth. So
Or notice light. Is that another? Okay.
it's called eye tracking.
Okay. You can hire me. I'm
Ukoju,
ready.
ukoju.
Yeah.
So technically, I mean, this is all what we early intervention includes. And then I target by the 4th year, I do a school placement, at least.
Wow.
By the 4th year, I do
Okay.
a school placement.
Okay.
Because school placement is very key. Perhaps we could talk about that later.
Yes, absolutely.
What are you looking for when you do a school placement?
Okay.
Yeah.
Absolutely. Looking forward to that. We're still receiving all your questions, your comments. When we come back after this short break, we'll be responding to each and every one of them. But Dr. you can just quickly highlight some of the things on treatment before we go on a break.
So all the health surveillance that we do is based on the age of the baby. So they're the things that you do when you're between 0 to 1 month of age. One is that we have to make sure that you don't have any congenital heart disease, meaning having holes in the heart, which are very common.
With Down syndrome?
With Down syndrome.
Okay.
And so the pediatric cardiologist needs to be on board. And what Duncan Kyengo mentioned in terms of the swallowing, making sure that we're not having aspiration, and that those who it's severe enough, so it's very variable.
Yes.
And so those may need swallow studies so that we can figure out a way of feeding in a safe manner. Then the other thing that we evaluate in that first month is making sure that we don't have any abnormalities in terms of your gut, because those are common. They're called they're gut atresias. There's the reflux that you're talking about. It's quite common. And then ensuring that by the time that we are stable enough that you can go for like the early intervention. Another thing that we have to assess is the vision, the hearing, and vision and hearing play a really large part in terms of language development, in terms of cognitive development, and those are quite common that we need to take care of that. We have to do some blood tests. The thyroid hormone, as Kyengo mentioned, we have to make sure that there are risks for having like blood disorders.
Could you share what the thyroid hormone is for someone?
So the thyroid hormone is important for not only brain development, but our metabolism. And it causes, it will aggravate low tone.
Okay.
So children who have Down syndrome are at risk for hypothyroidism. And if you already have genetically, you have low tone, and then now you have hypothyroidism, it will make even Duncan's work even more difficult.
Yeah.
And so that one we screen. And then we check for anemias, we check for the hemoglobin. So there are a number of blood tests that we do. And then
on a little baby.
On a little baby.
No.
And then we have we have goals for each time. So there's a goal that we look at from 1 month to 1 year. And it's about health surveillance, because we're trying to optimize the development of this child, making sure that the medical things are not left out. And then the other things that we ensure is, of course, the parents, because for Lilly, they're one of the few couples who are able to, come together and say, this is our stand.
Yes.
Not a lot of families like that in our culture.
So the police say, "Huyu ni mtoto wako."
Yes, those arguments, ilitoka kwenu. It's those things happen, and we cannot leave the parents out of our medical treatment, so to speak. So parents have to be supported. Grandparents have to be supported, because some of them grieve even harder than the parents, because when it's your child's child, so you're grieving for two people.
Yeah.
What's happened to your own child and what's happened to your grandchild. And so supportive in terms of the psychologists, the counselors, our medical social workers. Sometimes we get domestic violence. There's a lot of things that the pressure brings out characters, and sadly it's who the person who you married, who you didn't think about, can become somebody who you never knew.
So at
and
this conversation,
male or
people need
female,
to...
let me
yes,
not
please.
say just the men.
It's a conversation people need to have before they get married, like what if...
And premarital counseling, those are some of the things that should be discussed.
Yeah, absolutely. Is there any medication?
So it depends on what the problem is.
Okay.
If you have hypothyroidism, we give thyroxine. If you have an anemia issue, we can correct that. Of course, sometimes there are risks for like leukemias. That one now the hemato-oncologists take care of that aspect of things. So it's based on the problem that's at that time that we need to solve.
Absolutely. We'll be going out for a short break. Remember, we're talking about Down syndrome, everything you need to know. And when we come back, we'll be talking about how it actually happens, because I realize we kind of skipped that part so that we don't have it was your family, it was your side. We're going to sort that out right now. You are on Hope TV. Don't touch the dial. What you need to do is share this video. If you're watching us on Facebook, share it. If you're watching us on YouTube, share it. If you're watching us on TV, pick up your mobile device. In fact, I know you're holding it right now, and share this video. We'll see you shortly.
Have you ever wondered how to save your money?
This is the question I'm asking these young people.
How to invest and live the life you always desired? Coming soon on Spotlight, get to hear Waithaka Gatumia.
And with the cash that is left over, you purchase now income earning assets.
The CEO Centonomy Limited, giving you the do's and don'ts of finances and wealth.
When you find your purpose and your mission, No one has to check on you.
All you have to do is get your notebooks and pens and get ready to be schooled. This month, join Edward Furi for a candid and captivating conversation.
Every time, every single minute, there's something new to talk about.
The government continues to make sustained investments.
And we want to completely support and thank our healthcare workers.
Crime rate has dropped drastically.
We are intentional to inform you on stories happening far and wide across the globe from places never imagined.
We shape national discussion as we give you all the perspective to enhance, develop, and better our leadership, right from the national leadership to the tiniest point of administration.
Business remains the engine that makes the world go round. At Hope TV Newswatch, we strive to bring you the market trends as we focus on strategies that make you and your business afloat.
We pay attention, we listen, we observe, we feel, we margin, and we report. From cities all the way to the common Monanchi, we focus on all you need to know.
Here we transverse the countries to bring you the latest in the world of sports, from scores, fixtures, and breaking news as and when it happens across the globe.
For Hope TV Newswatch, now you know.
Join John Carson every weekday as he takes us on a journey through the Bible.
Whoever shall seek to save his life, if you go back to living for yourself, you're going to lose it. But whoever shall lose his life, give up his life for my sake, he shall preserve it.
Enjoy interesting, knowledge-packed, yet simple teachings through his humor and in-depth understanding of God's Word.
The last people that tried to put God in a box, literally, he rose again. He wouldn't stay in their compartment. If God was small enough for me to figure out, he wouldn't be big enough for me to worship.
Tune in to Hope TV for John Carson every 10 p.m., 4 a.m., and 10 a.m. weekdays on Hope TV, where you look and live.
And thank you for watching Health Check. Today's conversation on Down syndrome, quite informative. And as I said, when we come back, we'll be talking about how this actually happens so that we stop any myths and notions of it's you, it was the other one, it is, you know, a guy, I don't know what. We are going to dispel all that. But first, let me send some love to all of you on Facebook. Wow, I'm looking really nice. Okay. Really should put back my hair a bit. Okay, better. I see Jackie Baldwin watching this live, such great content. Thank you for watching. Karibu sana to this farm. Waina. I hope I said your name correctly. Please forgive me. Said very insightful, and thank you to all the panelists and Lilly Mugane for sharing your inspiring experience. Milka Kanini just says she's watching, and thank you also for those who are sharing the video. We have some questions coming in on our text line at 22232. Keep them coming so that we can answer them back to back to back. Daktari, with me in studio, for those who just joined us, I know you're wondering who are these beautiful faces. Today it's just pretty faces and a new daddy. Woo, woo, woo. A one-day-old daddy. Yes, you're the only guy here. It's definitely you. I see, of course, Dr. Susan Wamithi, developmental pediatrician.
Yes.
One of 3 in the country. Were you number 1?
No.
Okay, so you are number
2.
You are number 2.
Mm-hmm.
How did you find developmental pediatrician practice? Where did you decide this is what you want to specialize?
So it was actually so I grew up with a cousin who had cerebral palsy.
Oh.
And so, but like I didn't want to become a neurologist, I didn't want to become a psychiatrist, I didn't want to do rehabilitation. Mm-hmm. And then as I was doing my rotation with psychiatry, I found out about developmental pediatrics, and it seemed a fit for who I am as a person.
Absolutely.
Yeah.
Wow, that's an interesting story. We almost missed that. Okay, and of course we have Duncan Kyengo. He's a clinician. He's a doctor too. Awesome. Occupational therapist. Thank you for joining us.
Thank you.
Absolutely. We love him. If you want his story, go to our YouTube page and catch up with the episodes that he's on. And you get all his story there. And of course, we have Lilly Mugane, caregiver, mommy of 3 beautiful children. And today, this show is all about Munene. And we thank God for Munene because this couldn't have been happening if it wasn't for Munene. Are we right?
Very true.
Absolutely. Yeah. Let's do that. Daktari, can we pick up how does an extra chromosome appear? And it's a what's your group called?
T21.
T21 because of?
Trisomy
21, which is tri means 3. Uno, dos, tres, tri.
Yes. So 95% of the time, it's due to something called like a sporadic event. So it is nobody's fault. It is just the way, for me, I believe in higher purpose. It's just the way God has designed things, and we don't know why. But for us, as Lily has shared, it's just you grieve and you accept because there's a purpose for all these children. So it's a sporadic event, and it doesn't come from dad's side or doesn't come from mom's side. So it is just something that happens that changes that chromosome, that extra chromosome is there.
So it's not genetic.
So well, for us we call it genetic just because of that extra chromosome. So, but it's not. So there's a 3% where people have what are called translocations, and I'm avoiding it because I don't want to blame anyone.
Yes.
That's why I'm trying to get
into
those details.
Yes.
But let's just leave it at the fact that
it's a sporadic
most of the time it's a sporadic event.
During
there are those like 4%, but I don't talk about the 4% because my job is about reducing stigma.
Absolutely.
And about families being together.
Yes.
So I don't people going to look for who it is.
But hamwezi kosoa Mungu, like that one just trying to kosoa God, like by saying it's you. God created all people beautiful in His image and in His likeness. Actually, you have a comment? Yes, hot one. Go ahead.
Because I saw she was really trying. Munene has that translocation.
Yes.
Yeah.
It's translocation, and that's the 3%, which could be hereditary.
Yeah.
But for us, we chose not to know who it is.
Yeah.
Yes.
Because then
Then what?
and
Yeah.
then after that,
Lily, sorry.
I always say and avoid it because I don't lose, because there are people who dwell on that.
Yeah.
And just from my experiences in my clinic,
Absolutely.
I've learned to just.
I've seen it.
Yes, and yes, Kyengo has seen it. Yes, yeah,
we'll pick it up because that's really serious. But we have Helen calling in from Limuru. Helen, good evening. Helen, do we have you?
Okay, I can.
Thank you for watching Health Check. What's your question?
Mimi niko na mtoto ako na 4 years.
Aha.
Bado hajatembea.
Aha.
Na tunang'ang'ana, niliambiwa msipa mguu yake ni fupi. Na akawekwa hii kitu ya plaster.
Okay, we lost her. But did you get most of the information? Did you need to ask any questions?
I think I got part of what she's trying to say. Our concern seems the baby is 4 years.
Yes.
And the baby hasn't walked yet. And so I'm suspecting there is a deformity that's happening in the legs. So we particular point, but I think I had already gotten some of the few concerns. This is my advice. Discuss this matter with your occupational therapist. And you may need probably with an orthopedic surgeon, an orthopedic technologist. We deal with the leg issues first before we go there. But just this particular one, when children have hypotonia, because it's very common in Down syndrome, we say the science of walking in 2 legs, we call it the bipedal posture in human beings, requires something called vestibular stability. So one of the things that I like telling mothers, for example, I would want to tell the caller,
Helen,
I
hope you're watching.
to modify a swing. A swing. And that baby needs a serious swinging program. We develop our walking of 2 legs, and yet we carry a lot of weight with us because of it's called a vestibular system. When I talk of a system, I mean it has more than one, engagements that make it to be as stable as it is. So other than the legs part of it as well, you also need to deal with the other components of the system which enable children to walk. Perhaps I will share my number. If she could reach to me, then
please do. Just share it right now. You can share it right now.
Yeah, my number is 0726 272223. I'll repeat again. 0726 272223.
Awesome. But he's on paternity. At least give him a week. No. You're working? No. Okay, sawa. So let's go with it. Let's go to another question. Thank you. Keep your calls coming. Remember, we have a text line that's open. And Helen, you can also text in if you had a particular question that you need also responded to. 22232 is our text line. One here goes ahead and says, the show has been very informative. Lily, thank you for sharing your story. Dr. Susan, thank you for highlighting the need for psychosocial support. Dr. Duncan, I've struggled with my baby's therapy. She has AMC. What is AMC? She wrote AMC. And wearing the splint has been really hard for us. We push on though. She's saying the daughter has AMC.
Don't understand.
And wearing the splint, what's a splint?
A splint is a gadget that is used to support a specific part of a joint. That I understand, but I don't understand what AMC is.
Okay. Please text us again, Esther from Tunu, Africa.
Esther from
Esther.
Tunu.
So what?
It's also a bad deformity. So Tunu was born with that condition. So she has to wear that splint or something to help her walk or something.
I think, Lily, you need to mention that on the 21st of this month, we'll be hosting the Down Syndrome Day.
Please tell us more about it.
And we'll be having some clinics. We'll be doing a lot of screening. So
is it free?
I'm not sure.
Okay. 21st of...
The question everyone is afraid to ask.
It's a very important question.
It's a very important question.
So 20th of March, we have a T21 family support organization. We are hosted by Ability Center. Ability Center is where Kyengo runs. The occupational therapy. So he was good enough to give us some space as an office.
So come on. Do we make the call right now?
So for that day on 20th, the medical camp is assessing the issues that go, with Down syndrome. We have doctors who are coming. We are charging 2,500 for echo. But for echo, and echo, I think 4,500 in Kenyatta.
I think I have Helen back, and we'll here we say figures. We're honest. Helen.
Hello.
Hello, Helen. How are you?
Fine.
Have you had the response? And is another part of the question you had to ask?
Venye imekatika.
But umesikiza jibu umepewa?
Sasa mtoto ako na hizi Karyotyping. Hizo nang'ang'ana nazo sahi. Lakini kwa magoti kuna venye anaweka miguu, yani kama inagongana.
Okay, Helen.
Yes.
Utalias na Lily.
Yes.
Na labda kwa hiyo kliniki ya wiki ijao.
Yes.
Iwapo utaweza kutafuta nafasi uje, tutaweza kuzungumza kisha tuone jinsi tunaweza kukusaidia.
Sijakusikia ukisema ni wapi?
Ni Nairobi.
Nairobi. Where is it?
Gong Road.
Gong Road.
Yeah.
Tutapatiana details kwa show. Tafadhali kaa nasi.
Okay.
Asante. There goes my terrible Kiswahili. Asanteni watazamaji. Okay, let's continue with this. It's interesting that we can laugh in this situation. I'm sure it's never funny. I'm sure it's never funny. But God gives us the joy of the Lord is actually our strength. Absolutely.
Yes.
As we look at this, we've talked about Down syndrome. Is it preventable? What did we say?
So I don't think it's preventable.
Because you can't be there that sporadic moment.
Yes.
Yes, absolutely. We have that. Underlying conditions, we've talked about heart. And is that the major one?
So that's the one that we get, because that's the one that can cause death. So we don't leave cardiac issues unattended.
Okay.
And so you can have issues with things with your gut, constipation, something called Hirschsprung's disease. You can have reflux. You can have issues, of course, with the low tone that we know, vision issues, hearing issues, the cognitive development we always monitor. And for some children have issues with what's called atlantoaxial instability, meaning where your neck bones, for lack of a better word, the way they sit, because of the laxity of the joints, that can move. And so anytime, and that for me is such a important thing that I always talk about in the clinic. If a child, for example, who's already toilet trained, starts to pee on themselves again, for lack of a better word, poor bladder control, if their walking has changed, if they're walking with a head tilt, that's a person who has to be seen immediately, because it just means that something may have moved and maybe the spinal cord has been affected.
Absolutely. So immediately you notice any changes, you keep observing.
Yes.
Absolutely.
You have to go to the hospital. Don't observe at home.
No. You go to the hospital
go to the
immediately.
Immediately.
Absolutely.
Yes.
I'm picking all your questions still on our text line 22232. As we get to that, did we say that can Down syndrome develop later in life?
No, it can't develop later in life. So it may be picked up later in life, as Lily's case was at 3 months.
Yes.
And those who are not diagnosed, and you can imagine in the rural areas, where you're far away from access to healthcare, it can be diagnosed later on.
Okay.
But you are born with it.
Okay.
Yeah.
Okay. Lily, let's talk about living with Munene and just some of the things that you've had to do with your girls. You didn't tell me how the girls took it.
We actually didn't have like a sit down with the girls.
Okay, ever?
They were part of the
announcement.
Yeah. No. But for them, at that point, they were maybe young.
Okay.
And they've always seen Munene just like any other child.
Yeah.
So one time we were having a session with Munene. And I think the first girl is...
Now she's 11, so she was
that time
5.
She was 5, yeah. She asked me, why do you keep on pumping Munene's joint like this?
Yeah.
So I had a very, very difficult time to try and explain. And how come Mommy does not ask you to do this to us? So at some point I developed an habit when they come, I have to do 1, 2, 3 to the all of them.
Oh.
They realize, the thing for everyone, but because this one is a small baby, needs quality, but the others, but it's disclosure is it's about age factor.
Yeah.
Yeah, like the 11-year-old is someone who you can have a discussion with.
Yeah.
Just the way you do disclosure in an adoption, disclosure in sex education, I think it's the same sort of age that we use to discuss
and in the level that they can understand.
The level that they can understand.
Absolutely.
Yeah.
So at that 5-year-old, we didn't really tell them.
Okay.
They were 5 and 3. We didn't say, so Down syndrome.
Yeah.
But they've seen as we've continued. Munene is like any other child. There's no special treatment. He's even warned when it's time for chapa. Mom has gone to pick chapa, so they know.
So he behaved.
Yeah, he's done like every other. But with time now, they ask the question. So what is Down syndrome? They know I volunteer with T21 Family Support Organization. Whenever there are days, World Down Syndrome Day, we have all the T-shirts in the house, you wear, we celebrate with them, everyone in the family. So they know and they've asked, so what is Down syndrome? So at that point, when they asked when they were young, just said, it just means, first, an extra chromosome, and it also means he's having to work a bit harder to achieve the things that you already do. So like speaking, you need to teach him how to speak. So like the other day, I don't know whether, I know maybe Mudoni is listening, the second born. I heard her telling the firstborn, do you remember Munene used to call me Nonions?
Yeah.
Now he's calling me Munoni.
Oh,
soon he will call me Mudoni. And you know, it is my job.
Premium tears.
That's so good, yeah?
They were in the shower, I was in the other room, I was like, and then, you know, it's our job to make sure. I don't want Munene to be like 2 years or 3 years behind. It's okay when he's like 1 year behind, but not 2 behind.
Wow.
So they take it up as it's a challenge for them. It's their job to also help him get there. Because we've said with patience and lots of teaching, he will get there. So they are ready to do the lots of teaching and be patient. They fight like every other siblings do. And and they move on. They even have had them correcting their cousins and friends when they ask, why does Munene speak like that? And they will say, what is Down syndrome? They'll say he has Down syndrome. What is Down syndrome? It just means that it will take time for him to get there, but eventually he gets there.
Wow.
Then is it a disease? Will he get healed? So they have had them saying no. It's like when you're born left-handed. It doesn't change. So he will grow with Down syndrome, but we have to support. So I guess they have had now us talking and seeing media interviews or they've had to just learn as they've grown.
That's really beautiful. As we do this, we'll also you'll take us through how the treatment actually helped. Like this time he couldn't do this after seeing Daktari, after seeing occupational therapy, after the sessions and stuff like that. This has progressed, this has changed. I think a question that keeps popping up is there a life expectancy?
So back in the day, the life expectancy, especially if the cardiac things were not treated, and something that people forget is that sometimes you can get acquired cardiac issues, and so the health surveillance has to be done. So we have what we survey at every stage. So like I said, there's the infancy, there's from 1 year to 5 years, there's 5 years to 13, there's 13 to 21. So each time you see your doctor, those are the health issues that they're making sure that nothing's been left out, so that we can maximize their life expectancy.
Wow, okay. So there's none in particular, like, we stop. Let's go to myths and stories that you've heard about Down syndrome, and we dispel them right here, right now. We start with you. Start with you.
With me?
Yes, sir.
I've had stuff. Stuff that really stigmatizes.
I'm so sorry. People. And when we live here, no more stigma.
No more stigma.
Yes.
Tunyonge stigma.
Yes.
Yeah. I've had 1,001 times that the mama alikuja nayo. You know, it's men, we have a problem. When you have a very good son or daughter, it's called chest thumping. Unajigonga na unatembea kifua mbele. Wajua mtoto wangu ako starehe, sijui mwingine ako wapi na ako wapi. Lakini wakati mtoto anakosea basi asifaulu shule. But it becomes a problem of the mother. So one of the things is that women are responsible for Down syndrome. I've heard that a lot of times.
And it is not true.
It is not true.
You're welcome.
It is not true.
Next one.
That's not true. I've had old fathers.
The age thing.
Yeah.
I also saw that they said, the longer you take to get children, but people in their 20s and younger people, please speak on that.
So there is that tendency that when you're over 35, your chances are higher. It's called a high-risk pregnancy. But like you said, we have people in our 20s who have children with Down syndrome. So the risk is there when you're older, but it doesn't mean that when it happens to you, that it can't happen. It can.
Absolutely.
Yeah.
Which other one have you had? And you can also chime in, by the way.
The other one I've had is that maziwa when you don't breastfeed, you know.
But this thing happened during conception.
You see, these are the things that we really need to speak very loud about.
Okay.
Those people who decline to breastfeed, then they attract Down syndrome. You know, and especially this one, I found it I worked with the government in Lamu, some Peketoni district hospital.
Lamu is beautiful.
It's very beautiful. So I overheard this so many times. Because when I was there, I did a lot of screening. And this was very, very common. The other thing I've had is eating some foods when you are pregnant. For example, in Lamu I overheard ukila maini sana na ungali uko na mimba, you'll attract a child with disability. So I've had quite a number. Some of them are regional, and the others are sinning when you are pregnant. Yeah. Oh my goodness! Like the other day in our WhatsApp, sinning.
Dhambi.
You will end a dhambi. Yeah.
Na hii kwanza, this was practical. Apparently, skiza, he si ati it was being discussed. A mother came to see me. The pastor wa kanisa alimwambia mama hana imani ya kutosha, na kwa sababu hana imani ya kutosha is the reason why the baby is the way he is. This mother came to my office broken. Now this is the church where she serves as an usher. You get what I mean? And this is a pastor telling you,
oh, you have little faith.
Yeah, you have little faith and you sinned. Confess your sin, you know.
One to another. That you may find, no, we're not doing that. Yeah, we are absolutely not doing that.
We've had others like your husband has not paid dowry. So yeah, so it's like also punishment. So people stop sinning.
Can I say again, this is gotten during conception? Okay. Anyway.
Yeah. Okay. There's also another very...
So if you pay the dowry, it will reverse?
I think, no, before now then you conceive. Maybe you need to pay dowry before you conceive.
I had a mother mwenye alifanyiwa tambiko when that time I was in Peketoni. You know, tambiko ni cleansing ceremony. You know, you and then parents were called to come and pay the dowry because they expected when they do that, and then you have to slaughter one of those black kuku mweusi, you know, such things. That's a tambiko. Tambiko ni
right.
It's a cleansing ceremony.
Yes.
Yeah, whereby you.
But Jesus already died on the cross.
Huh?
Okay.
So there is also majini. Especially now Mombasa, Tanzania, we hear that a lot. Majini, that's or maybe you went looking for wealth. So kwa hizo majini. So that one is linked to most of these children are born in well-off families. That's what people think. I don't know why. To the point that, in fact, we said, now we are going to get wealthy. We are getting...
Oh, my.
I realized this, Lily.
Yeah.
You know, because of some of the comorbidities that come together with the nature of condition, for example, like heart conditions.
Yes.
If, you know, you require some fairly good amount of money to access correction. It's a very expensive affair. So for sure, those children who manage to live or to survive for a little bit longer, they are the children whose parents can afford. So if you look at it, especially in rural Kenya, those children who have managed to survive, majority of them are the people who have kitu kidogo kidogo. You know, then you end up feeling the notion.
It's a lot. It's actually a lot it takes a lot on the families, and we'll be talking about, as we wind up, we'll be talking about how we can support our families, relatives, neighbors, our community, people in our community with Down syndrome. But now let's talk about just a little bit the management. What are some of the practical things you can share right now to parents and everyone? I would like everyone to chip in this as well. What are the practical things you feel like you need to hammer to families that have children with Down syndrome?
So one is that you have to go for your well child visits.
Okay.
Your child needs to get immunizations like any other child because there are those anti-vaxxers out there. Because we don't want to put a child at risk for getting pneumonia. We've discussed that already. 3, you have to follow up with the blood tests that we ask for. There's a reason for that. And for me, I try and educate families to understand. So I send them copies of what we expect in the first year so that you know what it is that we are looking for. We're not just trying to take money away from the family, whatever it is. And then 4, for me, language development is very dependent on that hearing test being done. Because even if your we assess hearing through decibels.
Yes.
So even if your decibels are low by 30 to 40, you're missing the consonants. And not learning language, you have to hear it in its fullness. And so if you have, because they're at risk for all these different hearing issues, that has to be sorted out. And then the vision has to be sorted. For example, for Lilly to say, that's a chair, Monene has to see that chair.
Yes.
So that's why we ask for the vision to be done, because of course that will impair in language development if you don't know what a chair looks like, if you don't know what a glass looks like. And so all these different assessments that we're doing, I always tell the clinicians to explain why. So that when you explain something and you educate the family,
not just test,
not test,
damu,
because
shindano, damu, shindano.
So if you don't explain why, people are not compliant as to why the child needs to be seen. So you have to engage with your healthcare provider, and even if you doubt something the person is saying, just communicate. Open those channels of communication so that I can understand. If you don't have money now, let's push it for later.
Yes.
We have we negotiate the healthcare visit.
And people can also ask questions. I don't know why people don't ask professionals questions. Like, you go into the hospital and you ask. You ask, why is this being done?
Exactly.
Is there any other thing? Just ask.
Yes.
They're people, they understand.
And that's important for you to ask the doctor. Our job is to educate. For me, I can assume you know something, but that assumption, for me, my clinics take long because I'm trying to make sure this is how I'm wired. We are not missing anything out.
Reminding me of one Dr. Kapoor in New Amsterdam. I'm pushing this show too much, but asking questions.
Yeah, ask questions, talk to a healthcare provider, join associations like what Lilly's group is doing, because that's another avenue for resources and where else they can go. Like the medical camp, which I love, is that you're able, if you can't afford care, maybe you can take advantage of what other supporting organizations are offering.
Absolutely. We can only pick your calls for now. The internet is a bit down. So go ahead and call us live in studio. We can pick just 2 more questions as we wind up this episode. Please chime in on the same.
Repeat that again?
You can go ahead and comment on the same management and what parents do. Is there homework you give?
Oh, yeah.
When they take the children home? And has Lilly been doing all her homework?
Yes, this one was very faithful.
Okay.
So what happens is, as Dr. Wamithi has just mentioned, education is very, very important. Because if parents don't understand, they will not take some of the things that's very serious. For example, I've just talked about a mare swinging. So one time a mother asked me, "You mean I bring my baby, I pay this much, and then you just do this and you tell me to go home?" So that's a mother who, of course, I took time, tried to explain. Yeah, it's very important. So explain, when the mother understands, now you can give some things we call home programs. Home program, for example, is weka mtoto kwa beseni hivi, msupport hivi, weka blanketi hapa na hivi ikuwe stable, ndio mgongo, simamishe hivi, let the baby lie, spend quality time sleeping on tummy so that you get a good head control. There are small things here and there. But yes, there is a lot of home home program
That
involved.
people need to adhere to.
Yes.
Absolutely. Are there many occupational therapists in Kenya?
Yes.
Because you were saying, they need a watch doctor, they need a this. I'm just like, bro, Salah.
Yes, Kenya has recently increased a lot in training. For the longest period of time, only Kenya Medical Training College that used to train. Currently, we have Presbyterian University training. We have GQAT, Jomo Kenyatta University training. Yeah, so for every, I think, provincial, that's what we used to call, they are called level what now?
Level the county.
For the county. The level 5, every level 5 facility in this country has an occupational therapist. There may not be many, but at least they have.
Absolutely.
And probably the people who sit in the tables to make policy decisions is very important. Disability matters. They need to be given priority. The number of occupational therapists who are not employed today and the demand that is there in the government facilities is like heaven and earth.
Yeah.
You can't imagine.
Absolutely.
They are struggling here because of lack of employment, and the others on the other side, they are struggling because of lack of service.
They need the support.
Yeah.
Can you just pause, hold that thought? We pick Ruth in Eldoret. She has a question for us. Ruth, good evening.
Yes. Good evening.
Thank you for watching Health Check. What's your question?
My question is a question and contribution. I'm a parent with a 4-year-old who has Down syndrome.
Oh, thank you for calling.
Yes. Yeah. So my concern is when you're saying as parents asking questions, it's sometimes the people who we are asking questions, they really don't know how to explain the things that we need to know and how we are supposed also to take that. So like my son couldn't circle up well. So I'm learning it because of, I don't know if Dr. Kyengo said it. I don't know, you'll explain again.
Yes.
So I'm kept in the nursery being told, Mama, nyonyesha mtoto. Try and nyonyesha mtoto. I mean, nobody's explaining explaining to me like, because the baby has Down syndrome, it's also part of, it will affect how the baby will suckle. So as I'm learning, there are things I'm learning now that I should have learned when the baby was a little bit, like 3-4 months.
Yeah.
But also I'm also learning. Thank God for this program today. I'm learning a lot. So my concern is to the people who are supposed to give us the right information and how to do it should just, be given grace by God to do it, because if they don't take care of us as parents, how do we get strength to take care of these babies with special needs?
Awesome. Ruth, you're doing a good job. We're so proud of you. You're such a strong, beautiful woman. Thank you so much for watching.
Thank you.
Oh, okay. That's a concern and a contribution. What are we going to do about it? Daktari and Kyengo can also comment on the same. When we're coming back to you, I want you to I want to tell you what you're going to talk about, so that when we get to you, you chapter it. Encourage mommies who have babies who are not being put out there, who are maybe going through sadness and still maybe postpartum and probably other issues that they could be having because of the condition. So that's what we're going to come to, and then we're all going to give our closing remarks. I just got the ping for about 10 minutes to go. So you can talk to her and tell her in your place how you're listening, and what she's asking you to explain again. What was the issue where the baby couldn't suckle?
Oh, okay. This is it. We talked about when we talk about early intervention.
Yes.
So you doing an oral musculature suckling ability assessment is very important, because sometimes if you're not careful, you cause the baby more trouble in an effort to force the baby to feed. So what she doesn't seem to understand is why that happens. Children who are born with Down syndrome are born with a condition called hypotonia. which is mostly, it's technically the weak muscles that lacks the strength to perform specific chores. Like, suckling requires an organized oral coordination to, to track and
we take some things for granted, really, like being able to do some things.
And what you are never told is milestone behave like people running relay. One milestone is responsible for the one that comes ahead. For example, suckling, the act of doing suckling is very important later on for speech articulation. So when you have hypotonia, then it's very possible to get a suckling challenge.
Absolutely.
And we have a suckling challenge, it's very possible that you get a chewing problem. And you have a chewing problem also, it's very possible also to get speech difficulties later on as the baby grows.
Absolutely.
I hope I've answered her.
Absolutely. And at 4 years, what are some of the things now she can do to probably play catch up?
I would ask her to go for an assessment, a thorough assessment, and
she's in Eldoret.
Yeah, more referral. I can get a referral because I know I have quite a number of colleagues and I have quite a number of students who have taught, who have been placed there.
Malimu, he forgot to mention.
So I know it's very easy for me to get a contact there, and then she'll be sorted out.
Thank you. Thank you so much. And the interventions you've talked about in terms of the government, so many occupational therapists just need placements. Let's do something about it. I know the necessary people are watching, so do something.
What would I tell other moms and fathers, parents generally?
Parents.
Yeah. Recently, actually, before I get there, we have a WhatsApp group for fathers.
Okay. Oh.
Yeah.
How can guys join? Is it on Facebook?
Though we keep quiet like a whole week and one day wake up with one day, but it's fine.
Okay.
It's fine. Guys, you're doing a good job.
So how can guys join? Is it on the link? Is it on Facebook, on your Facebook page?
No, it's a WhatsApp group. It's controlled by men.
Okay.
It's just for men. Kyengo is the chief admin. We had to make him create a
If these guys want to join, can you guys post the link? You can post a WhatsApp group link on the Facebook page so they can find it.
Yeah.
So Kyengo will do
I will do that.
Okay.
Yeah.
Which
I'm not
Facebook
very
page
techy,
are you posting
but
it
I'll see.
Which Facebook page are you posting it on?
We are on T21 Family Support Organization.
Okay.
T for Turkey.
Yes.
21
for
First Family Support Organization.
Absolutely.
Yeah.
Talk to our parents.
So to our parents, I would just want to tell you, you're doing a great job. You sure have come far to have this child that you have. And as we said, as you've been told, this happens by chance. It's God's doing. So don't question yourself. Don't start thinking, could I have done better? Or did someone wish me bad luck or whatever?
Aliliangalia vibaya.
Yeah. You're good and your child will thrive. The most important thing for this child, just love them as they are. Even I, if I'm not loved and I'm hidden, I wouldn't be seated here. Maybe I wouldn't even be talking. So love your child. Give them the necessary intervention that they need. And Daktari has said, if you don't have finances, talk. You can negotiate, join support groups, because that's where you learn there are people with even worse conditions than where you are. You might be thinking you're bottom, rock bottom, but there are people in worse places, and you encourage each other to grow together. So big up. Be strong for your child. They will thrive and you'll be so proud of them. And let's do this for our God. Remember, once again, this child is first God's. You're just a caretaker.
Amen.
So just do a good job for your father.
Custodian.
Yeah.
Absolutely. Daktari, I think the truth is, if someone comes with a problem and you realize this child has a heart condition, you wouldn't turn them away immediately. You'll try and make the intervention and probably look for ways to Down syndrome is as you wrap up and encourage someone.
Okay.
Yeah.
So as we've been discussing today, Down syndrome means that you have an extra chromosome 21. And this causes you to have different health conditions that need to be managed. And of course, you also need early intervention to meet your milestones. What's important to know is that always seek help from somebody. We always know someone somewhere. Medical camp, who is offering free cardiac services, who's offering. So if you come and ask, we will find a way to get you access to those services. So don't shy away, don't keep your child at home. Our job is to optimize and do God's work in terms of your child's development, taking care of the health matters, the medical matters as we go along the way. Never look at your child differently. Try the best not to, because it is what God has purpose. And so that child has the purpose. Our job is to take them through and do God's will as a parent. For us as doctors, I always say we don't, in the case that the lady Dorit said that the nurses or the doctors didn't know why the child had low tone, why the child was not suckling, ask for help. We have all these different specialties so that we can work all together for the sake of the child. So my passion is about breaking down silos between the OTs, the speech, the cardiologist, the pediatrician. It is, if we are not working together, then we're failing the child.
Absolutely.
And so seek help for the healthcare workers out there. If you don't know something, call someone. Someone somewhere has an answer to the thing that you're struggling with. So
I love that. And that's just the art of collaboration. I mean, just like the body of Christ has many parts, then it's the same thing with, you know, there's one person who knows this, can do this, and you give even better treatment to the person. I love it. Duncan, how would you wrap this up?
I think 3 things. Number 1 is for the parents who have children who live with Down syndrome. Your children, people with Down syndrome can acquire maximum independence. They can live by themselves.
I love that. And I saw it today when I was trying to do, and the other days, because I've been researching for like a week.
Yeah, they can live. You've been. So it's about how you want to treat them. If you really think that your children cannot learn anything, because that's sometimes you Google and you read, Dr. Google will break your heart. But there's a lot these people can do. So please don't lose hope. I don't wanna, when you're 80, you still worry about who will change the diapers for, etc. No. So independence is very critical, is very important, and every matter of education, they should be channeled towards education as opposed to grades which come from school. That's number 1. And then number 2 is policymakers in matters that pertain to disability. In terms of personnel and people who, the handlers of this in childhood, in education, in vocation. Because do you want to tell me that someone with Down syndrome ukimpatia rada, carpenter, cannot do something?
They can.
Do you really want to? They cannot polish a shoe? Do you want to tell me they cannot usher you in come and tell you, please welcome, and give you a smile? So they can do. It's just a matter of an opportunity. So policymakers in these areas, we need to wake up. Occupational therapists are struggling out there for lack of jobs, and the children are also struggling out there for lack of services. Let the government employ, and then give them opportunities. Then the last...
And also you employ some more.
Yeah, amen. Okay. Pray with me.
I will.
The next thing is stigma. Stigma. By all means, we need to do a lot of campaigns.
Absolutely.
In church, in mosque, in our schools, in our families, and we need to educate everyone that it is not anybody's responsibility or anybody's fault that a baby with Down syndrome came into a family. They need to be treated with dignity and respect.
Absolutely. And we're looking forward to the 20th and checking out the social media and being on. If I came on ground, what would I do?
If you came on the ground, there's a lot that you can do.
Okay.
There's a lot.
So, okay, fine. So, check out on Facebook.
T21 Family Support Organization.
Absolutely. Yeah. And what's your T-shirt one more time?
Love does not count chromosomes.
I know. And that chick, I have an extra chromosome. So what?
Utadu?
That's how Utadu what? Absolutely. Thank you so much, Dr. for your company. Very nice to meet you. Absolutely. I want to thank you, Lilly Mugane, caregiver, and just, good energy all around. And of course, Duncan Kyengo, it's good to see you again. Congratulations again. Ungesema ningekuja na Pampers, but okusema. So round two. Awesome. God bless you so much. Thank you for watching Health Check. What you can do to spread awareness, this Down Syndrome Awareness Month, is share this video, follow the content, support. Ask, how can I support these family members? How can I come and be a part of them? What can I do? There's something you can do, absolutely. Tony Monday will be up with Newswatch at 9 p.m. So do not touch that dial. Have an amazing day. I'll see you tomorrow on Team Worship Wednesday on Hope FM, where you listen and live. Good night.